It would provide insurance coverage to hundreds of thousands of Kansas and Missouri residents who currently don't have health care. But at what cost?
This week, we unpack the contentious issue of Medicaid expansion on both sides of the state line.
Also on this week's local show, we meet the new head of Kansas City's largest foundation.
Principal funding for the local show provided by Francis Family Foundation, Frederick and Louise Hartwig Family Fund, Kaufman Foundation, Healthcare Foundation of Greater Kansas City, Johnson County Community College, John and Effie Spees Memorial Trust, Bank of America trustee, Richard J. Stern Foundation for the Arts, Commerce Bank trustee, and KCPT members. Thank you.
Hello, I'm Randy Mason.
And I'm Nick Haynes, and welcome to this first local show of this brand new year. You know, if you thought the fight over what so many now refer to as Obamacare was over, it is not. It has simply moved to state capitals.
While the Supreme Court upheld most of the Affordable Care Act, it left up to states whether to expand Medicaid. Medicaid expansion is going to be one of the most contentious issues lawmakers wrestle with in Topeka and Jefferson City as they prepare to start new legislative sessions in both states.
It is one of those issues that gets complicated fast. In this report from Sam Zeff, we try to make sense of it all by picking apart what's at stake so we can better understand the arguments on both sides.
Healthcare in America is as much about numbers and acronyms as it is about doctors and nurses. So in the next few minutes, you're going to hear a lot of numbers. 138% will be an important one. So will 15,400, so look out for those. You'll also hear a couple of bureaucratic phrases that simply can't be avoided when talking about Medicaid. The most important of those, federal poverty level, and something called DISH in the hospital world. But if you don't remember anything else about Medicaid expansion from this story, we want you to remember this.
For me, it will mean that, my life expectancy will go up.
That's Jennifer Wishar from Lawrence, who is one of about 500,000 people in Kansas and Missouri pulling for expanded Medicaid. Like almost everything with the Affordable Care Act, her predicament is complicated. We'll tell you more about that a little later. While you can debate whether expanding Medicaid is good public policy, what's tough to argue with is that health care keeps people healthier.
We know from long years of research on uninsured people what that means. That means they will be healthier, they will be more able to hold jobs, they will earn more money, their mortality rates will be lower. So we're actually talking about fewer people dying as a result of this.
Before we dig into the politics and policy of Medicaid expansion, it's important for you to know some of the mechanics. So here's some of what we talked about at the beginning of the story. Medicaid expansion is based on something called the federal poverty level. This is simply the income at which the federal government says you're poor. To be covered under Medicaid expansion, the income of a single person can't exceed 138% of the poverty level. That's about $15,400 a year. In Missouri, it's estimated that 300,000 people would qualify. In Kansas, about 240,000. And contrary to what many think, most of those people have jobs.
These are folks that work hard every day. They pour the coffee at the coffee shop for you in the morning. When you go to the convenience store and buy your gas and your lottery ticket, you see the same individual there. And it's very likely that he or she has that job and another job, and neither of those jobs provide them access to any kind of health coverage they can afford.
But expanding Medicaid is going to be expensive. Very, very expensive. An estimated $1 trillion over the next decade. Here's the deal. Washington will pay for it all for the first 3 years, and the state's portion of the bill, as the law stands now, will never go above 10%. Still, 10% of a lot is still a lot. Hundreds of millions of dollars more a year in both states. Neither Topeka nor Jefferson City are swimming in money, so how do advocates for expansion make their case? Well, they change the argument. The Missouri Hospital Association joined with the University of Missouri to produce this study that focused not on the delivery of health care, but rather the delivery of dollars and cents. The study says expanding Medicaid in Missouri will create 24,000 jobs, adding at least $9 billion to the state's economy.
What's been interesting of late is the business community has really come behind this very strongly.
Herb Kuhn is president and CEO of the Missouri Hospital Association, who's leading the charge to expand Medicaid. We expand Medicaid somewhere down the road, even at 90%, that's hundreds of millions of dollars extra a year, correct?
Correct.
But what I'm hearing you say is that with efficiencies, with increased employment opportunities, doctors, nurses, technicians, and other efficiencies, this is going to pay for itself?
All the numbers point in that direction, whether it's new opportunities for new employment with new taxes coming into the state, whether it's relieving the state in terms of some state-only funds that they do pay right now to provide health care services for individuals, and through other efficiencies. All the projections look like right now, at least through the balance of this decade, that this could ultimately pay for itself. It's a no net cost to the state of Missouri.
I would argue that we can reduce over time these other parts of the budget that is going into direct services if we expand Medicaid.
Sheldon Wisegrau runs the Health Reform Research Project in Topeka, and he says providing regular health care to tens of thousands of more people in Kansas will produce savings in places you haven't thought of. One of those places is in our jails and prisons. This is the Johnson County Jail in Olathe, which spends about $450,000 a year treating inmates with mental illness.
Jails the size of the Johnson County Jail, we're actually the largest mental hospital in the state of Kansas.
Johnson County Sheriff Frank Denning says 17% of his inmates are being treated for some kind of mental illness.
We can only deal with one part of it here, and that's simply incarceration and prepare them and treat them so they're able to go to court. But you're exactly right. Some of the intervention needs to be done before they come into the system, and that's going to be a big question that's going to be posed not only to the criminal justice system, but it'll be something that's posing itself right now to the mental health providers, to the legislatures that have to design funding for these types of programs that you and I are talking about.
Okay, it's time to talk about one of those bureaucratic terms we mentioned at the beginning of the piece. It's called DSH and stands for Disproportionate Share Hospital. And that refers to all of the money the federal government reimburses hospitals for their uncompensated care. One of the biggest providers of uncompensated care in the Kansas City area is St. Luke's. Officials there say they provide $45 million a year in care to people who have no insurance or no money. That figure would be much higher without DSH. And here's the catch almost all hospitals fear. Because the Affordable Care Act anticipated so many more people covered by Medicaid, in 2014 the federal government is drastically cutting back on DSH.
It is clear, and we've been able to do some projections looking forward, that hospitals and medical providers will have to make some tough decisions about what services they can continue to sustain without any means to offset the cost.
So without Medicaid expansion, you have to stop providing some services?
We haven't specifically looked at what those would be.
But there are some services that would have to go away. I'm not, regardless of what
yes,
they are, but
I
there
think
would some
it's
services
fair
would
to
have to
say
go away.
yes,
Right.
absolutely.
Layoffs? And not only service cuts, but Seelan says the possibility of layoffs. So she says with Medicaid expansion, St. Luke's will likely add jobs. Without it, service cuts almost for sure, and a chance for job losses. So now we have to deal with the politics. And in Missouri, that's very complicated because it's not just up to the governor about whether to expand. The General Assembly has got to get involved. So we're driving to Carthage, Missouri, which is right next to Joplin, where we're going to interview Representative Tom Flanagan. Flanagan is a Republican, vice chair of the Budget Committee, and has been on the board of McCune Brooks Hospital in Jasper County. So he knows health care and health care funding.
Obama won the election, and that's a fact. We have Obamacare, and that's a fact. So going forward in the General Assembly, that issue of Obamacare is something that we're going to have to face, and that is a fact.
But it's also a fact that the Missouri General Assembly is dominated by conservative Republicans. Indeed, new House Speaker Tim Jones has called Medicaid expansion reckless. The state estimates expanding Medicaid will cost Missouri taxpayers $400 million through 2020. But during that same time, The state will get $8.3 billion from Washington. And while Flanagan's door is open to Medicaid expansion, it's open just a crack. He's unimpressed with newspaper editorials in Kansas City, St. Louis, and Springfield backing expansion, or even a recent poll by the Missouri Foundation for Health that showed 52% of Missourians favor expansion.
In November of 2012, people turned down what arguably would be the easiest tax to raise. They said no to cigarettes. If they're going to say no to cigarettes, they're not going to turn around and say, oh yeah, oh, Obamacare, yeah, sure, we'll vote for that.
A lot of people lining up behind this. Missouri hospitals are for it.
Right.
Primary care physicians are for it. State Chamber of Commerce is for it. Kansas City Chamber of Commerce is for it. I mean, these are formidable people who don't necessarily fall on the warm and fuzzy side of healthcare. I mean, these are some cold, steely-eyed folks who are looking at the business side.
When I don't see it going forward. I don't see how you can look at what the Hospital Association put out, and I've seen their study. And it's a nice study. It was put together at the University of Missouri. It's a great study. But you're looking at something, you're going to try to go forward 8 years and project something 8 years down the road. I just got out of a meeting about 2 weeks ago trying to predict the consensus revenue figure for the state of Missouri going forward 18 months. And we had a lot of discussion and a lot of discussion on what that's going to be. And that's an 18-month figure. And now we're talking, the Hospital Association is talking going out 8 years.
Hard to believe?
I think so.
And there's even less believing in Kansas. If you had to make the decision, you would say no to Medicaid expansion.
Yes, I would. I would say no to Medicaid expansion, but we wouldn't stop there. It's no, we're not going to do this, but we are going to find ways that we're going to make health care more affordable and more accessible.
Dave Taubert is president of the Kansas Policy Institute, a conservative think tank. They did a study that says expanding Medicaid will cost Kansas $4.7 billion over the next 10 years. To be fair, the Kansas Health Institute has a study showing the cost to be 10 times less than that, but that just shows how complicated this whole thing is. And unlike Missouri, the decision to expand or not rests solely with Governor Brownback. The governor's office wouldn't go on camera, and in a statement simply told us, Governor Brownback continues to discuss options and alternatives with like-minded states and with our legislative partners in Kansas. Taubert says he's worried the federal government is so far in debt that it will eventually stop paying the 90% match and stick states with the bill.
The more that we start giving anything away free, in this case health care, the money that's going to cost is going to come out of school funding. It's going to come out of other social service programs, or it's going to come out in the form of much higher taxes, which is going to have an economic impact of reducing jobs.
In the end, all the studies, all the politics, and all the debate boils down to this. What does it mean for people like 35-year-old Jennifer Wishar? She was laid off a year ago from her job at a nonprofit in Wichita. She's one of 5 million Americans who are considered long-term unemployed. For now, she's covered under a provision of the Affordable Care Act for people with pre-existing conditions. But just like dish payments to hospitals, the Affordable Care Act gives and it takes away. The program ends in 2014 when Medicaid expansion takes effect.
But, I mean, people who have Medicaid know that if they go to the emergency room, you know, that's something that's going to be covered, and they're not going to go into bankruptcy because of that. What do I want to tell them? That we matter. I mean, simply because people are low income does not mean that they are in any way less human or less deserving.
That report by Sam Zeff. KCPT's reporting on healthcare issues is funded in part by a grant from the Healthcare Foundation of Greater Kansas City. I think when you say Kauffman Stadium, everybody knows baseball is played there. You say the Kauffman Center for the Performing Arts, great music and symphonies and ballet. You say the Kauffman Foundation to people. I think it's almost good to do a little just reminiscing here about how the Kauffman Foundation came to be and why it's so important to Kansas City this many years down the road. Thoughts on that?
It's a great question, and it's one that all of us who are involved love to talk about because it gives us a chance to talk about Mr. Kaufman. And his passion for this community is well chronicled. I mean, you mentioned a few of the things that his legacy has made possible. We care deeply about education for disadvantaged youth, thus Kaufman Scholars, and what we're doing with the charter school and other educational support. But he also left a real challenge to those that he entrusted with the foundation on entrepreneurship. What can we do as a foundation to begin to help people who have that fire, if you will, to create a business, to be part of the American dream, to help them be as successful as they can.
Do you find those two go hand in hand and sync up really well?
As I say, operationally, we obviously have things like the charter school, which is a school that we run. We're into our second year now, up to a couple hundred students. We'll be adding a grade next year, occupying our new facility over at Paseo and Meyer. But if you step back, what Mr. Kaufman viewed both of these activities supporting was to have people become self-sufficient, independent contributors, not only to their own family and their economic welfare, but contributors back to the community and society as a whole. And to achieve that, obviously one direction is a quality education that prepares somebody, some part of the population, to just participate in jobs and so forth. But also there's a subset of that would benefit the whole community by starting new businesses, keeping the vibrancy of the economy going. So they're really run hand in hand. You wouldn't necessarily see that initially from the way the programs are set up, but both the educational content and the entrepreneur go back and forth all the time. And there's always an opportunity in any endeavor to, let's just call it an entrepreneurial approach, to find a better way to do things. We attempt to do that on the educational side also.
You're both not unfamiliar with the operation. Jan is taking the chair that you've been occupying for a number of years while you move into the president and CEO role. Are the things that have been going on the right things, or are you starting to go, well, now that we're in these positions, we're going to shift things in any particular way? Focus is changing at all?
Well, obviously the two missions we've been working on for some time, and at least my view is that there's not a lot of stuff that needs to be fixed, so to speak. I think one of the things that we will both work on is getting more visibility of what we do to the Kansas City community, because I think to some degree that's under-recognized, and so that's important. If you looked at the two sides, on the education side, and we all talk a lot about that in Kansas City because of some of the unique challenges we have here, quite frankly, there's a lot of very solid, proven educational programs that we have found around the country, in some cases that we have worked on ourselves. There's more solutions to education than there are acceptance of the solutions. There's still experimentation to be done, but in many cases it's getting us a district or a community to accept the solutions, and there's always the issues there that one deals with because of the structure of those. On the entrepreneurial side, it's about the reverse. A lot of it's very experimental, or how do we find the right answer there?
Do you find it fun to be around these entrepreneurs? I know there's weekends spent with them. Sometimes you guys put on any number of different programs. Does it excite you to have some of that going on?
Oh, absolutely. Not only their energy, but their willingness to embrace new ideas and bring them, and if you will, put their own skin in the game to make them work. But I would also say that same kind of commitment to things that work is going on in the education area, and Kaufman Scholars is a great example of our commitment to taking what we've learned to avail ourselves to the proven solutions on helping students that are falling behind in reading, for example, in math. How do we integrate that now and effectively move these students along effectively at a greater speed? So we're focused, I think, and very committed now to some results that we can talk about in the community and also share nationally where it's appropriate.
Speaking of sharing nationally, documentary that I think you all have been fairly familiar with that is going to be airing across the country on public television stations. Something Ventured is a way that you have helped participate in getting the word out about entrepreneurial spirits and the notion of venture capital. We wanted to share a quick clip with people that I think shows you what a fun topic this can be. Why don't you take a look?
We didn't know what we were doing.
Silicon Valley, technical breakthrough.
$100,000.
$1 billion.
Intel.
Apple.
Genentech.
Cisco.
Good markets.
Great companies.
Growing companies.
Sky's the limit. The rest is history.
The company was started with $250, and so we never had any money. You have to be brave.
These are very fragile companies with a lot of things missing.
Any new business seldom does what's written in the business plan.
The risks were just enormous.
You could walk down the street in 1976 and talk to 100 people and say, would you like a personal computer? And they go, well, what's that?
Jobs and Wozniak came up to see me, and they were very unappealing.
They were bearded, they didn't smell good, they dressed funny.
Yeah,
But Woz had designed a really wonderful computer.
I was convinced it was a big market just embryonically beginning.
When you see it, you know it. It's just that just goes right through your bones.
Something Ventured, a documentary here on public television, and Kauffman Foundation among the sponsors that made that possible to get distributed to the country. So we thank you for that. I want to say, Tom, DST Systems, from which you came, was, I think, around in the 1970s, at that time when those personal computers were such a new thing. Has that experience that you brought from, bringing a company through all those decades really prepared you for the job you're about to take?
Well, I hate to say it's totally prepared me, but I think it was a great experience for me. In that period, DST was really started as part of Kansas City Southern in 1969. And I specifically remember when we started looking at PCs and, should we have them on the desktops of the assistants and so forth. At that point, you could have had your choice of a PC or a Miata for the same price. They were about $13,000 when the first ones rolled out, like most technology waves. I think what you learn in businesses that have a technology component to them is you pretty much have to reinvent them at a much more rapid rate. This isn't necessarily like a major manufacturing business where the product has longer term durability, because it is well represented in that video, which, by the way, is a great expression of the type of partnership we like to do with KCPT and others, because the film was actually produced elsewhere, but we supported the dissemination of it, the broadcast of it. But going back, when you look at the rate of change, that's one of the things that's really particularly important. And having dealt with that, I think that helps a lot in coming into a Kauffman where you have extremely bright people and a lot of challenges that require rapid adaptation.
We'd like to let you get back to the things that you need to be doing, but it's great to have. It's kind of the new blood here that's not brand new, but is changing some shape over at the Kauffman Foundation, and the chance to kind of understand where all this is going with you. It's a pleasure to have.
Well, it's great to be here, and we really want to thank KCPT for the way you support our community and highlight the things that are making a difference. Thank you.
Well, thank you. And finally this week, do you happen to have a stash of potentially valuable breakables, such as glass, china, and porcelain laying around your humble abode? What about collectibles such as vintage toys or heirloom furniture? Well, guess what? One of PBS's most popular shows is heading into Kansas City.
I'm Marcia Bemko, executive producer of Antiques Roadshow, and I'm here to tell you about our 2013 summer tour. We've got big news this year. We're going to 8 cities, and that's 2 more than usual.
Yep, the Antiques Roadshow is rolling into town for the first time in 11 years. Mark your calendars. August 10th is the date, though no venue has yet been released. But like KCPT's The Local Show on Facebook, and we'll keep you updated. on any of the treasure trove of details.
You're at the top end of the Stuyland cat print market.
I'm stunned.
Do you like cats anymore after that?
I'm beginning to love it.
Great.
It's probably an auction worth $60,000 to $90,000. So it's a good lamp, that's for sure.
Amazing.
I'm Randy Mason. We'll see you next time on The Local Show.
Principal funding for The Local Show provided by Francis Family Foundation, Frederick and Louise Hartwig Family Fund, Kaufman Foundation, Healthcare Foundation of Greater Kansas City, Johnson County Community College, John and Effie Spees Memorial Trust, Bank of America trustee, Richard J. Stern Foundation for the Arts, Commerce Bank trustee, and KCPT members. Thank you.